Hello everybody, Michael here. This video I want to talk about my chest reconstructive surgery. I am 3.5 months post-op. Um, so I live in Newfoundland, Canada, and as far as I know, there are no surgeons here who perform female-to-male chest reconstructive surgery, at least to what I would consider my satisfaction in terms of results. So uh, I knew one of my friends had surgery, so I asked him where he went and looked up the clinic where he had his surgery, which was the McLean Clinic in Mississauga, Ontario. The doctor there is Dr. Hugh McLean, and he actually has a website dedicated to female-to-male chest reconstructive surgeries. So from the research that I did on his website and him, I felt like that's where I wanted to go for my surgery. So I scheduled a phone consultation with them in July. Well, I contacted them in July, and the consultation itself was in August. So I spoke to Dr. McLean, and he asked me your typical questions like, have you had general anesthesia before? How did you arrive at wanting the surgery, etc. So I had a great conversation with him, and he really helped me feel more comfortable about actually having surgery because I've never had surgery before. So then I coordinated with my mother because she had agreed to come with me to help take care of me following the surgery and stuff. My parents live in New Brunswick, so I flew to New Brunswick, and then we drove together from New Brunswick to Mississauga, which took a day and a half. Prior to that, the clinic had sent me test requisition forms, so I had to get blood work, a physical, and echocardiogram. I think one of those to test your heart. So got all that done, results sent off, and I had a pre-op appointment with them the day before my surgery, which was October. The surgery was October 22nd. I arrived on the 21st, so I met Dr. McLean there. His nurse took pre-op pictures of my chest, which, is weird, but like she said, she takes pictures like that all the time, so, all she sees is lighting and skin, I guess. So when I met Dr. McLean, and during our phone consultation, I felt on the fence as to which procedure I would get, the keyhole or double incision. And from the pictures that I had sent, he wasn't sure either. He said it could go either way. I really have to feel your skin elasticity and stuff before I could really say it for sure. And I mean, I'm 30 years old. If I was 19, I think the results would have been more towards keyhole, but let's face it, when your skin's 30 years old, it's not as elastic as when you're 19. So when I arrived at the clinic, he had a look at me, and he said that he felt like I would be a good candidate for the keyhole, which surprised me because I felt like the double incision would be what he would recommend. So he said he felt either way, it was really up to me. So I went back to my hotel room with the decision to make of whether I would go with the keyhole or the double incision. So I got on my laptop and looked at before and after pictures, mostly his before and after pictures to see, how he would perform those surgeries, the results that those individuals had gotten. And then looking at their pictures, looking at myself, how do I compare to these individuals, and other factors that I considered was the double incision surgery itself would take approximately 2 hours, where the keyhole would take closer to 3. Just simply because with the double incision they have more room to work with versus the keyhole, there's a little space. And what was important to me, what results was I looking for? So I decided to go with the double incision, mostly because it was more important for me to have results that I would be happy with, even with the scarring. Just looking at scars that I have on my body, most of my scars have healed to be pretty white or close to color to the rest of my skin, and I think I'm going to be pretty hairy, so I figured that if I have a hairy chest, those scars won't be nearly as visible anyway. And plus, I live in Newfoundland. It rarely gets hot to the point where taking my shirt off would be happening. So, in my list of priorities, shorter surgery time and better chance at the results that I was looking for was what affected my decision. So I had the double incision. Um, Surgery itself was really good. I mean, they gave me the anesthesia, and they pretty much the anesthesiologist just said, "Oh, I just gave you the good stuff now." And next thing I knew, I was waking up in the recovery room with this very nice nurse, and so it took me a while to wake up. I felt hungry, which was huge to me because I had heard of people waking up nauseous and stuff from the general anesthetic, and I was terrified that that would happen to me. So it was a huge relief to feel stomach okay when I woke up. So the clinic was actually attached to the hotel room that we were staying at, so the nurse called my parents. The nurse wheeled me to as far as where the pedway connected to the hotel, and then I walked the rest of the way to my hotel room, ate a banana, took a painkiller, went to sleep. I pretty much did nothing but sleep, take pills, and eat, a little bit for the next 24 hours. The next day, I felt good enough to get up on my own, walk across the street to this nice little Korean restaurant, and have some sushi. So I was really, really happy that I felt that good that fast. We left Mississauga Friday morning. My surgery was Wednesday morning. So 48 hours later, we were on the road back to New Brunswick. So that was rough. Sitting in the car for 16, 17 hours in a 2-day period was rough. Luckily, it was mostly on the highway, so it was a pretty smooth ride, and my parents got an SUV, so I had lots of room to kind of move around, try and get comfortable, but, you're still in the car. So, and then after that, I stayed at my parents' house for the week before I flew back home in Newfoundland. So, I wanted to give myself as much recovery time as I could before flying, because I knew I'd have to, carry my carry-on, and just generally flying, that's draining when you're feeling good, let alone when you're weak post-op. So I met with my doctor here 10 days after my surgery. She took off my nipple grafts, which were basically little yellow sponges that had got stitched on over my newly placed nipples. I had no idea what to expect. She had done that before, so she knew exactly what she needed to do to get them off. So I basically just laid down on the table, she just cut stitching, and the sponges just came off. My nipples were sunk in, which freaked me out, but she said it was completely normal, and that I actually looked really good. So I was really pleased with that. My incisions themselves, I have 2 incisions, I'll show you in a second. But that was just covered in tape. I had no stitches or staples or anything like that. So the tape had been on there since the surgery. I hadn't taken that off. I was very careful not to get any of this wet. The doctor said I could get the tape wet, but the grafts sponges should be kept dry. So, but I didn't get any of this wet. Maybe the tape a little bit there, because, washing under your arms when you can't get this spot wet is really hard and awkward. But, you do what you gotta do. So, yeah, she took the grafts off, the sponges, and the tape off, which was really weird. Knowing that my skin was cut open for almost 6 inches, and she just ripped the tape right off. So, but anyway, she was really, really pleased with how I looked, so that really set me at ease, and yeah, that was great. So, following that, recovery-wise, it took me longer than I thought it would to get my energy back. It took at least a month before I felt close to where I was before in terms of energy. Not even picking up and lifting things, just like being able to go for my walk with my dog and going to work and doing some chores and stuff like that. That was draining. I actually asked my friend to keep my dog for me for an extra week because I didn't have the energy to take care of him like he needs, because I don't have a yard, so I have to walk him a couple times a day. So that was I was really glad that they were willing to take him for me. Um, I was not expecting my skin to hurt as much as it did. It felt like sunburn combined with that feeling you get when your foot's been asleep for a while and it wakes up again. That's what this whole area of my chest felt like. So my shirt rubbing up against my skin was painful to me. It wasn't extremely painful from a scale of 1 to 10. It might have been like a 2 in terms of pain, but just the constant discomfort, well, I felt was really draining. Um, so for that alone, I didn't work my full days a lot for that first week. I often go home early just because I felt just so tired, and the aggravation of that was uncomfortable. Um, I wore a binder um, for 2 weeks after my surgery. So uh, it was mainly to protect my chest versus keeping it tight. So because my nipples were grafted on, I had those sponges there. I had like a padding over my whole chest area, and it was just like a rubber type elastic. Not rubber, it was like an elastic type material band that I would just kind of Velcro uh, that tight to my chest. Now, I didn't have it tight depending on what I was doing. Like for sleeping, I just keep it light so that I wouldn't, catch anything in my sleep. But when I was out walking around, I'd keep it a little bit tighter so that it wouldn't move around so much and hurt me. So, and after I had my grafts taken off, my doctor wanted me to keep that on for a little while longer, just to make sure my nipples were protected, and I was all for it. Whatever helps me heal better, make sure that I don't lose a nipple, I was game. So I wore that for around 2 weeks. So that was that. It was so nice not to have to wear binder ever again. I cut up my old binders, so that was pretty awesome. What else? So I didn't lift anything over 5 pounds. Well, you try. 5 pounds is not a lot. So you just day-to-day stuff. But I tried really hard not to lift anything heavy. Like some of my friends, they were my lackeys. Hey, can you pick this up for me or whatever? So, but after around 6 weeks, I felt like I was almost back to myself in terms of being able to lift some things. Now, I wasn't carrying any heavy things because I didn't want to hurt or strain my chest, because sometimes if I did lift something that night I would feel sore, so I'll try to minimize that as much as possible. I'll show you. So as you can tell, my scars are, well, my left scar is very nice and straight. My right one for some reason has a wave to it. I'm not that worried about it. My nipples, I feel, are pretty symmetric. The right one, I feel, is a little off, but really, I feel really happy with how that looks. It's hard to tell in this video because of the coloring, and the lighting not that good, but they're starting to fade a little bit now. They're not as red as they were before. My nipples themselves, this one feels like it's going to be more scar tissue than this one. Like, this one feels and looks almost normal now. My nipples were pretty much just a scab for like almost a week after I had my grafts taken off. So trying to be careful not to catch the scabs and not picking at the scabs after, and trying to let that heal and the scabs fall off on their own. So the doctor told me that was really, really important to make sure I didn't pick at stuff. So yeah, I feel really, really happy with my results. I still have some numbness left, even 3.5 months post-op, mostly around here. This nipple I can feel now when I touch my nipple. This one is a bit more numb. But here I got sensation again. And here. So, yeah. I can't think of anything else to talk about for my surgery specifically, but if you have any questions, please feel free to send me a message. If you're curious as to the clinic itself, they actually gave me this bracelet when I was there, but topsurgery.ca is the website that the McLean Clinic has dedicated to just chest reconstructive surgery. So if you're living in Canada and you're wondering, or I guess even the States, check it out. I was very, very impressed with my experience with that clinic. So that's it for now. We'll talk to you later.